Aha! All right. Well, some of you who know me know that I'm technically incompetent, so it's not unusual for these kinds of things to happen, and because I don't know how anything works, you know. In fact, I'm one of those people at the office when something goes wrong, they tell me to just step away from the computer. Actually, you could go home for a while and come back, you know. Don't touch anything. So thank you for being patient with my technical challenges. So I am Pam Popper from Columbus, Ohio, founder and executive director of Wellness Form Health, and we specialize in informed medical decision making. And what that means is knowing the risks and benefits about the things that you're intending to do or contemplating doing in healthcare. That's diets, supplements, drugs, screening tests, procedures, and knowing those risks and benefits before you decide to act. And if people would do that, if they would buy healthcare the way that they buy cars and houses and blenders and washing machines and college educations for their kids and retirement accounts, we could clean up the healthcare crisis by 5 o'clock today. Because if people actually looked at the information, if they considered the evidence before they took action, probably 2/3 of healthcare would go away. Most of the food companies would be out of business, and we wouldn't have to hear about the paleo and the keto diet every day on Facebook and Twitter and social media, right? So unfortunately, people don't do that right now because they don't know that they're supposed to. How many of you at one time, and maybe sometimes you're going through this process right now, but how many of you at some point in time thought that your doctor knew best? Anybody? Did what your doctor said, right? And you probably have friends who still feel that way, that the doctor who's head of the department at the local university medical center certainly knows what he or she is talking about, and following his or her direction is the best thing to do. And that's how people get hurt. So stop looking for nutritional gurus, medical gurus, start learning how to look at information and filter it for yourself. So my talk today is on diet, exercise, and mental health. And I'll start by telling you a little bit about my inspiration. So many years ago, I realized I've always been very careful about scope of practice and what I know about and what I don't know about. And when people would bring up depression or anxiety, or I noticed that they were taking drugs like Prozac or Xanax, I really didn't talk about it very much. I didn't think it was my area of expertise. And once in a while, somebody would ask me, like, I'm really feeling depressed, what should I do? And I would refer them, I'd say, look in your insurance guide, you know, they'll have a psychologist or psychiatrist you can go and see. And I really didn't realize how dangerous that advice was at the time. But one day when I was running, and by the way, I love running, and it's when I get all my great ideas, and if my knees go out, we have to close the company, I think. But I was out running one day, and I had this epiphany. It's like nobody who's depressed or anxious or whatever's going on with them, they just don't seem to get better. Years of therapy, years of drugs. I never knew anybody who was coming off of their drugs, only going on drugs. And so I thought to myself, what if the mental health business is like the cardiology business, it's like the endocrinology business, it's like all the other branches of healthcare where there's something out there that works. Like you could actually fix this problem the way that you can fix clogged arteries and blood glucose dysregulation and some of the other things that you've heard a lot about at this conference. So I started looking into it, and I found out that there were really good therapists out there who helped restore people back to psychological well-being and mental function. They didn't prescribe drugs. People actually got meaningfully better in a short period of time. And I found a therapist locally. I did a lot of searching to find this guy. And we had a meeting, and we were on the same page on this issue and many other things. And so I gave him my books to read and my stuff, and he said, listen, if you want to learn about what I do, you should read Peter Breggин's books. I never heard of Peter Breggin. So I bought Peter Breggин's books. Peter Breggин's you're gonna hear from him today. He's in the front row. And I started reading them, and I was just astounded, absolutely astounded. First of all, I've been telling the truth for a long time about healthcare. And as you have heard throughout this conference, there are a lot of consequences to being a truth teller. Apparently, that's a bad thing to do in some people's eyes, but Dr. Breggin, like me, has taken great risks to tell the truth about psychiatric drugs. He's a psychiatrist who's been in practice for over 50 years and has never started a patient on psychiatric drugs, but instead does this incredible thing called talking to them. Who knew? You could talk to people and help them get better. You could show that you care and guide them through a process of finding out that they could make a better life for themselves. And that sounds like a whole lot better idea than drugging. So one day, I got my courage up and I called Dr. Bragan's house, and I got his lovely wife, Ginger, who agreed that Dr. Bragan should speak at our conference, and he did. That was 2012. And over time, we became very good friends and decided that our work was very compatible and that we should be offering mental health programs at Wellness Forum Health. And so that was the beginning of really taking a deep dive into this topic of mental health and psychological health and what's really going on with people and that sort of thing. So with that, we'll go on ahead and get started. The first thing is, if we're going to apply the informed decision-making model to mental health, the first thing I need to tell you is there are no studies showing that there's a chemical imbalance in the brain that causes any psychological disorder. And I'm only going to cover a couple of foundational things because I have to make something really clear to you before I start talking about diet and exercise. There's no way to measure neurotransmitters in the brain like serotonin. In fact, the studies that have shown that there is a neurotransmitter deficiency have been done on animals who appear depressed. And I've always wondered how you look at a rat and determine that the rat is depressed. But anyway, people claim to be able to do this, and they find that the serotonin levels are low. But you can't do that to humans. According to a psychiatrist in the UK, he says, indeed, no abnormality of serotonin in depression has ever been demonstrated. So fortunately, there are some psychiatrists who've always spoken out about this issue, Dr. Bragan. There are some psychiatrists who are starting to try to come clean with this issue that we've drugged about 25% of the population in the United States without reason. And Dr. Ronald Pies, who was a psychiatrist at Tufts University and former editor of Psychiatric Drugs, says, in truth, the chemical imbalance notion was always kind of an urban legend, never a theory seriously propounded by well-informed psychiatrists. He actually said this on an NPR interview. Well, an urban legend that resulted in 25% of the country being drugged, that's pretty astounding when you think about it. Well, when pressed further, he goes on to say, my impression is that most psychiatrists who use this expression feel uncomfortable and a little embarrassed when they do so. It's kind of a bumper sticker phrase that saves time and allows the physician to write out that prescription while feeling that the patient has been educated. That's interesting. And then he went on to say a little later, it was a little white lie. Well, I think it was a ginormous white lie, if you ask my opinion about it. So what psychiatrists have told Americans is that the drugging of people in the United States has led to better outcomes. But 1 in 6 adults right now in the United States reports taking at least one psychiatric drug. 84.3% of the people use them long-term, and they were never designed for long-term use. An analysis of 522 trials involving 21 antidepressant drugs with 116,000 plus patients showed that the drugs were barely better than placebo. And so the public's been told that all this would make things better, but 850 adults and 250 children who take these drugs are placed on disability every day in the United States. That doesn't sound like things are getting better to me. Disease mongering is the process of expanding the definition of disease so that you can treat more people. And this goes on in every branch of medicine, and psychology and psychiatry are no different. So the Diagnostic and Statistical Manual has grown from 30 diseases to almost 300. And some of the recent diseases that were added are caffeine withdrawal. You certainly need to be drugged for that. So, central sleep apnea, hoarding disorder, neurocognitive disorder, PMS, restless leg syndrome, and social communication disorder. I'm really interested in that one. How exactly do you define social communication disorder? And so my point in all of this is that these are not biological diseases. Shyness is now a disease. Grief is a disease. Almost any symptom that somebody has is a disease. And so this results in a 50% chance that if you say the right thing to the right doctor, you could be diagnosed as having a mental disorder and placed on drugs. Not good. Doctors in all medical specialties are prescribing the drugs. It's not just psychiatrists. And many patients aren't depressed or anxious. They're malnourished, dehydrated, and sedentary, and the symptoms are similar to depression. So you take short visits with family practice doctors and OB-GYNs and others who people see. And here's the conversation, I think, as it happens, and there's some research to document what I'm saying, is the doctor says, how are you doing? The patient says, not so good. You know, I'm getting divorced, and I'm having to move, and the kids aren't doing so well. It's a very stressful time. I'm having trouble sleeping, and it all starts to sound like depression, all right? So here's some Prozac. But actually, if you don't eat well, and you're hypoglycemic, and you're dehydrated, and you're overweight, and you eat terrible food, that can cause exactly those same symptoms. You know, I don't feel like doing anything. I'm having trouble sleeping at night. I don't have any energy. And some of these symptoms start to sound the same as depression. So I'm convinced that one of the things that's happened is that doctors who've been trained to look for depression, there was just an article in the American Academy of Pediatrics journal teaching pediatricians that they need to be more mindful of identifying depressed children and adolescents so that they can be drugged. Okay, so doctors are being told you should look out for this, mental illness is an epidemic, watch out for this in your patients so that you can take care of them and keep them from going downhill. So what happens is medications prescribed for people who are just having everyday stress or who are just dehydrated, sedentary, overweight, and eating terrible food. Almost every negative thought, emotion that people have is considered pathology requiring treatment. The standard of care is drugs. And this ignores the thought that the diet and exercise and physical health could have something to do with mental health. But I want to be crystal clear, and one of the reasons I wanted to give you this background is that I don't want anybody to misconstrue the things that I'm going to tell you as saying that mental health or mental health issues or psychological issues are biological in nature. They're not. What I'm telling you is that the way that you take care of yourself and your state of health can contribute to your state of your mental state and your psychological state. And that you can make things better, not only by getting the right therapy, but by taking care of yourself. One of the problems is drugs are easy to prescribe, not very easy to deprescribe, and it's very difficult for people to withdraw from them. So you'll hear more about this from Dr. Bregan, but the brain adapts to the drugs. It starts to function differently. Withdrawal produces dangerous, sometimes symptoms. The brain can be very slow to recover from the damage from the drugs. Judgment and self-control can be impaired. Severe depression, mania, psychosis can result. And the original person or the original problem for which the person was drugged comes back with a vengeance in many instances because it hasn't been dealt with while the person has been drugged. So many prescribers don't know how dangerous the drugs are. They don't know how to take people off the drugs. It's easier to find people to prescribe them than deprescribe. Withdrawal is complicated. A team approach works best. You're going to hear about all of this from Dr. Bregan. Building a strong body through diet and lifestyle change can lessen the effects of withdrawal. It doesn't take away the effects of withdrawal. And it's not a solution for people who are clinically depressed, clinically anxious. It just makes it easier. And there's a significant body of evidence showing that diet and exercise contribute to mental health. So when I started looking in the medical literature, I was hoping I could find a little bit of documentation for what I'm telling you. Because I've seen this in my own practice where people say, that they come in, they're eating a terrible diet, they're dehydrated, they're overweight, and they're sedentary. And they start exercising, they lose weight, they eat better, and they say, I feel better, I have more energy. I'm doing a lot more things than I used to. I don't go home and just lay on the couch. I feel like going to the gym and going out with friends. And so you see their mood change, all right? And so I've seen this in my own practice. So I was hoping I would be able to find something that would document this in the medical literature. And it was astounding what I was able to find. In fact, the historical perspective, this goes back several centuries. Ludwig Feuerbach said, what one is what one eats. We are what we eat. The use of food to address psychological disorders dates back thousands of years. Ayurvedic medicine historically has used plant foods and herbs to regulate mood and psychological treatments. It included medicinal plants like pepper, valerian, turmeric, curcumin, pomegranate, cinnamon, sandalwood, garlic, radish. Indian snake root was used to treat insanity. And this goes back thousands of years. Sometimes we've known what the answer is for a long time. We just have chosen not to act on it. Today, in fact, there are lower rates of depression, anxiety, and psychosis in populations of people who eat more of a plant-based diet. You sure have been hearing a lot about the benefits of a plant-based diet when it applies to diabetes, cancer, heart disease, and autoimmune diseases and that sort of thing, but we see the same effect here. So I'm going to show you some studies. And I had to pick a few. In other words, this part of a course that we teach, which I'll tell you about later, there's 8 hours of lecture. So I'm always speaking in front of this group trying to condense 12 hours into one or 8 hours into one. That's sort of what this is here. But I'll show you just a few studies. And I think in some cases I'll read the study conclusions because they're pretty profound and worth repeating to you verbatim. So a study of 1,046 women between the ages of 20 and 93 showed that women eating a traditional diet of vegetables, fruit, fish, and whole grains had lower risk of major depression, dyspnea, and anxiety. The risk increased for women who ate more of a Western-style diet with fried foods, refined grains, sugar, and beer. A study of over 3,400 middle-aged people regarding diet and depression. Whole food diet, fruits, vegetables, and fish. Processed food diet was refined grains, high-fat sweet desserts, processed meat, high-fat dairy. Participants in the highest quintile of eating whole foods had a much lower risk of depression. Data from prospective cohort study of 4,215 United Kingdom civil servants concluded poor diet is a risk factor for depression in women. The healthier the diet, the lower the risk of depression. And I'll show you some mechanisms of action for this that will make it a little more clear. Over 1,100 adults, 30 to 64 years of age, with low education and income levels, diet quality significantly was associated with the risk of depression. Now, one thing that I'll mention to you that I think is really important is that when we start talking about diet and any disease, and I don't even like to talk about mental illness. I don't think there's any such thing. I think people have difficulty with everyday life, so I hate to use those kinds of terms. But when you're talking about diet and any disease, everybody's looking for a food or a nutrient. So if I take vitamin C, will it make me better? If I take high-dose niacin, B vitamins, whatever the condition happens to be. But I will tell you from scouring the medical literature, you are hard-pressed to find a dietary supplement, a single nutrient or a single food that improves mood. What you find is that people who eat in a particular way, a pattern, have better health. So those are the studies I'm sharing with you. And when I taught this class the last time, one of the assignments that the students had, and I'm kind of funny about the way I give assignments, and I probably shouldn't say this on tape because the next group will know, but I phrased the assignment to make people think that they're supposed to come up with benefits. So I assigned, I want you to do some research and write a paper on the benefits of these supplements for mental health. And so some of them even wrote to me and said, is this a trick question? Because I can't find any benefits. I said, well, just do the assignment and then you report what you find. You know how this works. And so they all come to class and they're a little bit confused about this. We meet, it's a teleconference class, and they turned in their papers and the first student says, frankly, I don't think I understood the assignment right because you told us to find benefits and I couldn't find any benefits. I said, well, that was the assignment. Okay, so you found out exactly what I wanted you to find out. I just didn't want you to start with some kind of bias. So look for information refuting the claim. I wanted you to look for information confirming the claim and then tell me what was really there. So that's why all these studies are based on dietary pattern, because that's where we really see a difference. A study of 97 adults with mood disorders, there was a consistent association between more nutrient-dense diets and better mental health. Where's the nutrient density in the diet going to come from? It's going to come from plant foods. There's no nutrient density in toaster pastries, right? Pretzels, that kind of thing. And I'm going to read this quote. I said sometimes the quote is worth reading from the article. This detailed analysis in a clinically diagnosed sample was consistent with prior epidemiologic surveys revealing an association between higher levels of nutrient intakes and better mental health. All right? Diabetes and depression are common comorbid conditions, and I can understand that. It's kind of depressing being a diabetic. A diet with more vegetables, leafy greens, fruit, cooked whole grain, and whole grain bread, protective against depression and type 2 diabetes. And by the way, while you're getting rid of your depression associated with diabetes, you can get rid of your diabetes too. All right, so that's one of the things that I like about talking about diet is the breadth of the effect. In medicine, usually the treatment that you get is very specific for the particular thing that the doctor is seeing you for. And one of the problems we have in medicine is it's so fragmented. Have you noticed that? Like you go to lots of different doctors everybody specializes in a body part, and they're prescribing a specific treatment for that body part that they're in charge of. Your brain, your pancreas, your liver, whatever. Well, when you talk about diet, the breadth of the effect is really worth talking about because you solve one problem, you solve a whole lot of others, and you prevent a whole lot of bad stuff from happening too. So much better approach, and also less expensive than all this medicine. A study of over 3,800 Iranians between the ages of 20 and 55, lacto-vegetarian diet was associated with a lower risk of depression. People in the top quintile of the healthier diet had decreased risk of anxiety as compared to the bottom quintile. The traditional diet, with lots of fat, lots of meat, was associated with an increased risk of depression. The worse the diet, the worse the risk of anxiety. Okay? So again, we're not talking about neurotransmitters in the brain. We're actually talking about people feeling better when they eat better. Is that hard for people to understand? Has anybody here changed to an optimal diet and said, this is the worst I've ever felt in my life? Broccoli, rice, sweet potatoes, and salads really make you sick. Okay, people don't feel that way. They feel more energy. They feel better, right? And I love this, again, a quote. Recommendation to increase the intake of fruits, citrus fruits, vegetables, tomato, and low-fat dairy products, and to reduce the intakes of snacks, high-fat dairy, chocolate, carbonated drinks, sweets, and desserts might be associated with lower chance of psychological disorders. Okay, so if you don't want to be depressed and anxious and psychotic, I don't think you can eat your way there, but I think it can help you get there. I think eating better can help you to remain mentally healthy. A study of 138 Seventh-day Adventist men and women, vegetarians had significantly less negative emotions than omnivores. Now, this is interesting because vegetarians consume less EPA, DHA, and omega-3 fatty acid and arachidonic acid than omnivores. It doesn't matter. And this is, again, a quote worth looking at. These results challenge what is known about the link between dietary fats and brain function and suggest an unrecognized benefit of vegetarian diets, which are naturally low in the long-chain omega-3 fatty acids. So going back to the assignment that I gave the students, look into omega-3 fatty acids and find a benefit. Tell us the benefits of taking those for mental health. Couldn't find any. Because as it turns out, what you're eating in the food is more important than that single nutrient being taken in high doses, right? So when we focus on the dietary pattern, you get a much better result. 39 omnivores randomly assigned to 3 diets. The control diet just kept on eating meat, fish, and poultry. The diet including fish 3 to 4 times a week and avoiding the meat and poultry, and then vegetarian style, avoid it all. The conclusion, restricting meat, fish, and poultry improved moods the most. Not surprising. Those randomly assigned to the vegetarian diet who were most anxious at the beginning scored lowest for anxiety in 2 weeks. Same with fatigue. The most tired at the beginning got better. So the people who are in the worst trouble have the most benefit from the diet, okay? Which is interesting because what you would probably intuitively might think is that the people who are in the most trouble, oh, they're in such bad shape, it probably wouldn't make any difference if they changed their diet. Not true. It really does make a difference. The authors noted that a high intake of arachidonic acid, which is concentrated in animal foods, causes changes in the brain that can negatively affect mood. And one of those changes is inflammation. Arachidonic acid in animal food increases the production of series 2 prostaglandins, which are inflammatory. Study in Puerto Rico, including 80 patients. 2 groups, vegetarian, non-vegetarian. Not surprisingly, after what I've been telling you, anxiety and depression reported in the non-vegetarian group. 18-week randomized controlled trial with 292 participants. The vegan diet resulted in improvement in depression, anxiety, and productivity. A study of vegetarians, vegans, and omnivores. Again, I'll quote, increasing restriction of animal foods, conversion from vegetarian to vegan is associated with improved mood. Now, let me tell you why this is very important. When you see a dose-dependent effect, this is very interesting. It tells you there's really something going on here. So you convert from being an omnivore to a vegetarian and it gets better. And then you convert from a vegetarian to a vegan and it gets better. It tells you the more plants you eat, the better your mental health. That's a very, very strong, that increases the strength of the finding quite a bit. Same thing is true with adolescents. Subjects with poor dietary pattern develop more emotional and behavioral problems. And this is important because we have an epidemic of children who have psychological disorders, and we have an epidemic of children who don't eat well. In fact, we live in westernized countries. We have this new thing going on. I don't understand it at all. It's called kid food, right? I don't understand kid food. In a lot of other societies, when kids get weaned, they just eat food. They eat the same food as the rest of the family. And now we have kid food, and the kid food is disastrous, like macaroni and cheese, and there's a kid menu in the restaurants. And now we have adults who grew up on kid food who are convinced that they should give kid food to their kids. So we're going through generations of people where the eating habits get progressively worse because of the history of the parents. Subjects with good diet at baseline had fewer psychiatric problems, but if the diet took a nosedive for the worst, then the problems began. All right? So a healthy diet is defined as consuming, and this is what the authors of the study said, fruits and vegetables and avoiding junk food. Well, I think most of America's youth would be a whole lot better off, and in fact, youth in all countries would be better off if they ate a lot more fruits and vegetables and a lot less junk food. Data from almost 3,000 ethnically diverse adolescents showed a clear connection between diet and mental health. Adolescents eating unhealthy diets, the highest quintile of processed and junk food, less fruits and vegetables, more than 2 times more likely to have psychological problems than those eating a healthy diet. Case control study of 849 girls, adolescent girls, Consumption of ramen noodles, hamburger, pizza, fried food. This is what kids live on, and other processed foods associated with an increased incidence of depression. On the other hand, green vegetables, fruit, higher intake of fiber associated with decreased risk of depression. And we could go on, but do you get the idea? The same research has been presented or done in China. And by the way, this is another important thing that I look for when I'm doing research, is that I don't want to see a study showing something. I want to see research that's been replicated in different parts of the world, different research groups, using different methodology, and come up with the same conclusions. So we're doing research in Iran, we're doing research in China, in North America, in Australia, and everybody's coming to the same conclusion. What you eat has a lot to do with your psychological state, so we shouldn't be ignoring this. Another study of adolescents in New Zealand, same thing. Eating a better diet, better emotional health. Another study of 23,000 women and their children. Women who eat well during pregnancy, their children have better mental health. After delivery, women who eat better, their children have better mental health. Not hard to imagine. So the bottom line is that, and we could go on, like I said, this just part of this could go on for the rest of the afternoon, but after a certain point in time, it becomes a bit repetitive. When you eat fruits and vegetables and plant foods, you feel better, and when you don't, you feel worse. So we go on to the next topic, I guess, at this point in time. All right, so now I want to talk very quickly about the gut microbiome, which is related to your diet and mental health. So I teach this. I'm going to put this into 3 or 4 slides. This is a 14-hour course I teach on the microbiome. We're going to condense into very short information here. So just to give you some foundational knowledge, and I know Dr. Goldhammer talked about this too, there are 100,000 times more microbes in one human gut than people on the earth. This is a very big colony, all right? 100 trillion cells total. It means that only 10% of our cells are human, and the rest are renters renting space from us in the gut. These bacteria perform certain functions from us. There are 1,000 species containing 7 million genes, 360 genes for every 1 human gene. So I want to impress upon you the importance, the size of this population. Humans and microbes depend on each other for survival. We get more from the microbes than they get from us. The gut microbiome right now is part of every medical specialty. I don't think I discuss any diseases where it's not at least brought up for discussion, including, and I don't like to even call it a disease, but psychological disorders. So how do you get your microbiome? Well, we get some of it in the placenta. There are about 300 different species there. Vaginal birth, babies born vaginally acquire bacteria in the birth canal, and then breastfeeding. And so already you can see we have some problems. Increasing number of people born via cesarean birth. We have the highest birth rate in the United States of cesarean birth in the world. And while sometimes that's necessary, it's overused. And then a lot of formula feeding rather than breastfeeding. And then diet, which I'll get to in a minute. So microbes talk to each other, and the microbes talk to the brain. The gut microbes influence our emotions, our pain sensitivity, our social interactions, decision-making. They generate and send signals to the brain, and they can reinforce and prolong our emotional state. The connection is hardwired, by the way, through the vagus nerve, and then it also involves molecules traveling through the bloodstream. And the gut has its own nervous system. It's called the enteric nervous system, ENS, or second brain, which is made up of between 50 and 100 million nerve cells. All right, so feelings of anger and threat and fear override and divert the ENS from its routine. Stress hormones like cortisol are released, nerve signals are sent to the ENS that inhibit function. The behavior of the microbes is altered. It's influenced by bad things like traffic and stress, and it's influenced by good things like hugs and sharing a meal with friends. Dysbiosis and inflammation in the gut are linked to psychological issues including anxiety and depression. And functions are affected, like your digestion can stop, stomach doesn't empty properly, have diarrhea, or you vomit. The number of endocrine cells in the gut are more than the total of all endocrine cells throughout the rest of the body. And if you spread them all out, it's bigger than a basketball court. The signals are sent to the brain, things that you're familiar with, fullness, nausea, discomfort. And then we also get signals from the brain. We call them gut responses. And I want you to consider this for a minute, how much language we have that talks about the gut and emotions. Has anybody ever said this? I have a gut feeling about this. Anybody said that was a gut-wrenching experience, right? How about I'm all choked up? Butterflies in my stomach, all right? So the reason why our language is filled with those kinds of statements is there's such a relationship between the gut and some of the feelings that we have. So the gut is the largest storage depot for serotonin. It's used to regulate normal gut function, sleep, appetite, pain, sensitivity, mood. So people always think about serotonin, because you've heard so much about it, as serotonin in the brain and mood, but serotonin is a hormone that does a whole lot of other things for your body. And it's produced by the enteric cells in the gut. So it functions as a hormone, and then it also functions as a neurotransmitter as well. SSRIs, drugs like Prozac, are used to treat depression, and some of the side effects of those drugs include nausea and diarrhea. So it's interesting that drugs that are targeted to treat depression have such an effect on the gut. Serotonin release affects emotions and feelings, and here's something that's interesting. Food moving through the system stimulates those enteric cells to produce serotonin. So first of all, that's why people can feel better after eating. That's one reason. It's another reason why people feel better after adopting a plant-based diet, because first of all, it's a moving experience. Have you all had that? All right. But the second thing is that fiber moves food through the system more quickly, which means that you have to eat more frequently. When people eat like really high-fat, high-protein lunch, they can go for 6 hours without eating again. If you eat something really high-fiber, high-carbohydrate, you eat lunch at noon, and by about 3:30, you're probably ready for something to eat again. So going back to what I said earlier, where I'm not talking about clinical depression, I'm just talking about people who will say often in changing their diet, something I didn't expect is how much happier I feel. I really feel better on this diet. So there's a biological reason for that. So the gut microbiome and psychological issues, I think it's interesting that in 1933 they were writing about this. So a psychiatrist by the name of Joseph Kilman wrote, "It is far from our mind to conceive that all mental conditions have the same etiological factor, but we feel justified in recognizing the existence of cases of mental disorders which have a basic etiological factor, a toxic condition arising in the gastrointestinal tract." So we knew that in 1933. We probably knew it before then. We just don't talk about this stuff because it's a lot more profitable to sell drugs to people. It's a lot more profitable to be a psychiatrist who prescribes drugs to people because then you don't have to take time to talk to them, right? So lots of things happen. You'll hear more about that from Dr. Bregan. So negative changes to the microbiome are common in conditions associated with a higher incidence of depression, like IBS, chronic fatigue, obesity, and type 1 to type 2 diabetes. So here are just a few studies, some on animals, some on people. Germ-free animals bred for research have significant alterations in brain development, especially the parts of the brain involving emotional regulation. Transplanting fecal pellets from an extrovert mouse turns an introvert mouse into an extrovert. All right? Microbes from obese mice can turn lean mice into overeaters. Interaction between the brain and the gut can either promote optimal health or destroy health or make people vulnerable to many diseases and reinforce negative emotions. Intestinal permeability is a common finding among kids, family members who have autistic family members. All right? So we see this very close connection between the gut and the brain and emotions and emotional regulation. Doesn't mean that you have a chemical imbalance in the brain. Doesn't mean that you don't need therapy. It means that if you eat better and get good therapy, you're probably going to get better faster. Now, I think this is really interesting. We prescribe a lot of antibiotics. Antibiotics are tremendously overprescribed, and we have a lot of problems resulting from this, including antibiotic-resistant bacterial infections like MRSA and C. diff, which used to only happen in the hospital, and now we see them in community settings. Well, the development of all kinds of problems follow an antibiotic regimen. One of those problems is destruction of the gut microbiome. We're increasingly using broad-spectrum antibiotics, and the problem is that they're indiscriminate bacterial killers. So anyway, it's interesting. An analysis of patient records showed that people with serious mental disorders who were hospitalized for mania were more likely to be taking antibiotics for infection than people hospitalized without psychological problems. Many studies have shown that taking antibiotics can lead to psychiatric and behavioral problems. And in addition to the destruction of what's called the commensal bacteria, the gut microbiome living in your gut, the bacteria living in your gut, it may be due to damage to the mitochondria as well. So review of studies looking at the connection between vegan diets, gut bacteria, and inflammation. The vegan diets had the best effect. And so if you've screwed up your gut microbiome, and that is part of your problem, and it can be part of your problem if you have diabetes, inflammatory bowel disease, autoimmune disease, allergies, asthma, and depression and anxiety. Changing your diet can really have a profound effect. And I just picked one study, and I'll read you the conclusion because I think it's important. I could show you 200 like this. The vegan gut profile appears to be unique in several characteristics, including a reduced abundance of pathobionts and a greater abundance of protective species. Vegans also appear to lack the intestinal microbiota for converting dietary L-carnitine into the pro-atherosclerotic TMAO. Reduced levels of inflammation may be the key feature in linking the vegan gut microbiota to protective health benefits. And so it doesn't get much more clear than that the vegan diet is best for your gut microbiome, and a healthy gut microbiome is good for your psychological state. Probiotics. In mouse experiments, probiotics were shown to lower anxiety levels. Particularly lactobacillus, which is one of the primary bacteria that you want to start taking when you're restoring your gut. When stress tests were administered, the mice given the bacteria were willing to venture out into open spaces more than controls, more likely to struggle instead of give up when forced to swim. In fact, the effect of probiotics was similar to the effect of antidepressant drugs when they were given to mice. I think it's a whole lot safer to take probiotics than antidepressant drugs. John Cryan, who's an Irish psychiatrist, did some rat studies using bifidobacterium, gave it to rats, reduced their depression and anxiety as much as Lexapro. And you can see here the list of references. Other studies have confirmed that the probiotics are as effective as Lexapro. IBS patients, twice as many patients taking a probiotic reported improvements in depressive symptoms as controls taking a placebo. A double-blind placebo-controlled study showed that 30-day supplementation with lactobacillus and bifidobacteria lowered psychological distress and depression and decreased anger and hostility. So some good reasons to take probiotics. And again, we could go on and on. I could show you slide after slide after slide after slide, and it starts to become repetitious. The take-home point is that taking probiotics is good for your gut. A review of 10 studies concluded that daily probiotic supplementation can improve mood, anxiety, and cognitive symptoms in people with major depression. The most significant effect was on anxiety. And researchers concluded that this might be a good idea because of the limitations on drugs, including limited efficacy and safety issues. And you'll hear more about that later. There are some significant safety issues. So again, not reading more studies to you, but same thing. Randomized double-blind placebo-controlled trial of patients with CFS, chronic fatigue, reduced their depression. 5 studies taking probiotics resulted in significant reduction in depression and reduction in risk of depression. So where are we right now? Adopt an optimal plant-based diet, take a daily probiotic. Does that sound easier than taking Lexapro and Prozac and Xanax? How many people think that's a better idea? Okay. Again, not a substitute for therapy to resolve the thinking disorders and the problems that you have to resolve in everyday life. That's why good therapists are really worth seeking out. But if you're going to therapy and you're shaping up your body, you're probably going to get more out of the therapy. Really, when you think about it, it's kind of another level. When I was talking about individual nutrients in foods, dietary pattern. Okay, so how about dietary pattern, probiotics, therapy, and now we'll talk about exercise. Do all of it. Most people who get better do a lot of things to make their health better. A lot of things. You don't really see many case reports in the medical literature saying a person who is depressed, overweight, diabetic, had a banged up knee and migraine headaches, took omega-3 fatty acids and it all went away. Okay? I've never read a report like that. You've never met anybody like that. People do multiple things to improve their health, and that's what I'm suggesting here. All right, so exercise and mental health. And I never miss an excuse to promote exercise because it's the hardest thing we have to get people to do. I mean, people have unbelievable excuses for not exercising. And what do you think the most common one is? I don't have any time. And I used to be a lot nicer about this, but now I just tell people, well, you know what the reason I exercise every day? I have nothing to do. Nothing. I sit on the couch, I eat bonbons and watch TV, and the exercise is such a welcome reprieve from the sitting and doing nothing. And they go, oh, Dr. Pam, you're so funny. Yes, indeed. But seriously, you do have time to do it, and it's important to do it. Being sedentary creates all kinds of risk factors, not just for being depressed or anxious, but everything else you don't want to have happen in terms of your health. So research shows that inactivity is associated with the development of psychological disorders. Increased physical activity is associated with a lower risk of developing psychological disorder. Now, one thing that we could ask is, does being sedentary contribute to depression? Does depression cause people to become sedentary? I think it actually goes both ways. But the issue is, no matter how you got there, if you're depressed, starting to move around more is going to make a difference for you. So Robert Brown and his colleagues at the University of Virginia took 561 volunteer students. They chose to exercise or not, and then they chose how much exercise they were going to engage in. The active groups all have reduced depression scores. Students with the highest depression scores who chose to exercise 5 times a week had twice as much improvement in depression. So again, we see the same phenomenon that we saw with food, in a dose-dependent manner. You do more, you get more benefit. The worse off you are, the bigger the benefit you get. So one question that got asked in one of the panel discussions, or somebody asked it to me, is there ever a time when it's just too late? I'm so far gone, why bother? There is never a time when it's too late or you're too old or you're too far gone. It always makes a difference. And I've seen people in their 70s and 80s who have started to eat well, exercise, get hydrated, and get good therapy, and they start to open up and live life and enjoy the remaining, they extend the years they have on the planet, and they enjoy all of them a whole lot more. So it's never too late. 30 community dwelling, moderately depressed adults, randomly assigned to exercise, social support, or weightless control. The exercise intervention, boy, it wasn't anything really big, you guys, walking 20 to 40 minutes 3 times a week for 6 weeks. It was the most effective thing for relieving depression. Participants randomized to exercising on a cycle for 30 minutes 4 times a week. Exercise resulted in clear reduction in depression compared to controls. It was sustained at 3 months of follow-up. Now, I want to ask a question, just to take a survey of the audience. How many of you started exercising after a long time of being sedentary? Okay. How many of you hated it in the beginning? And then you stuck with it. At some point in time, you turn the corner and this starts to feel good. I actually feel better when I do it, right? That was me. I sat for the first 20 years of my adult life, which turned out to actually not be a very good plan. And then I started working out, and I hated it because everything hurt all the time, and I was no good at it. Nobody likes to do stuff they're no good at. But eventually, you turn the corner and you get to the place where, and how many of you feel this way? I feel worse when I don't exercise. If I don't move for a few days, it's like, oh my gosh, I got to get to the gym. I got to go out and run. I need to go to yoga tonight. I got to do something that will cause me to feel better, right? So anyway, we're really not talking about anything far-fetched here, and we're not talking about anything that most of you haven't experienced at some point in time. Just 30 minutes of treadmill walking for 10 days resulted in statistically significant reduction of depression on HAM-D scores. Depressed adults who engaged in 12 weeks of training versus controls, the training group had greater reductions in depression, anxiety than the controls, and the gains were maintained through 12 months of follow-up. And that's what's so significant about this, is once you change your diet, if you stick with it, once you change your exercise patterns and really start moving and you stick with it, it keeps getting better and better and better. You don't have relapses from diet and exercise. Well, unless you quit doing it, then you have a relapse. But if you stick with it. Resistance training, weightlifting, has been shown to reduce the symptoms of depression. A study comparing running and weightlifting versus control, both types of exercise reduced depression. Both groups maintained gains at follow-up. The controls got worse. So people start out in the same shape. The exercises get better. The people who sit still get worse. Running is shown to be as effective as psychotherapy in relieving depression. I subscribe to a magazine called Runner's World because I'm a runner. And one of the things I like about that magazine is the inspirational stories of people who've taken up running and what happens to them. And some of the most inspirational stories are people, particularly since this is such a big issue right now, who are they become addicted to opiates or heroin or something like that. And they all talk about how much better running has made them. And I think the first thing is if you're running and you're doing marathons or you're working out at a gym or whatever, you're hanging around with people who value health. There's some value in that. Just the company you keep does have a lot to do with this. But the other thing is when you run and exercise, your brain makes something called brain-derived neurotrophic factor. And you're wiring new pathways in your brain, literally rewiring your brain as a result of the activity that you're engaging in. 156 depressed adults randomly assigned to exercise, medication, or both for 16 weeks. Medication worked more quickly, but at 16 weeks, there was no difference between the groups. And we see this because the drug trials are so short. A lot of times it looks like drugs are really effective, but if you followed people for a long enough period of time, lifestyle changes work a whole lot better in the long term than the drugs do. And therapy works a lot better too. A 10-month follow-up, the exercise group had significantly lower rates of depression than medication or combination groups. Analysis of 30 studies showed the most important factor in efficacy of exercise for depression was the length of the exercise program. The longer you do it, the better things get. equally effective for men and women, all ages, and for people who are severely depressed. Again, the worse off you are, the more benefit you actually gain from all of this. Exercise has been proven for both anxiety and panic disorder to be helpful. Study of 24 people with severe anxiety, randomly assigned to aerobic exercise sessions or no exercise control. Subjects in the aerobic exercise group had significantly less anxiety after exercise, no change in the controls. And many times when people are withdrawing from psych drugs or they're anxious, going out for a run or going to yoga class can lower their anxiety levels. Again, not a substitute for good therapy, an adjuvant to good therapy. So you give people more tools for helping themselves feel better. A review of 31 articles showed that regular aerobic exercise improved anxiety and panic disorder. Regular exercise lowers the level of neuroticism, anxiety, and depression. I mean, I know this about myself. It's kind of interesting. Our office is a really busy place. And sometimes I'll be thinking, should I go to yoga in the morning, when everything is so busy? You know what my staff says? You should go. I'll say, well, we're really busy. They go, no, you go. We got it, okay? And you know why? Because they know I will be so much easier to deal with if I go to yoga or I go to the gym. So nobody in my office ever suggests that I miss a morning workout or yoga class to do work, because they know that it's better if I do that. I'm calmer, I listen better, I'm easier to get along with. 4 or 5 days no exercise, I start to get a little sharper tongued, a little more impatient, don't listen so well. I mean, it even makes you better at your job when you do this. 128 men hospitalized with major depressive disorder. This is really important. Anxiety disorder, alcohol addiction, toxicomania, psychotic decompensation, and bipolar disorder. These are very sick people. Those who participated in physical exercise showed significant improvement in mental health. Patients with major depression showed the most interest in exercise and spent more time. The best results were from cycling and hard gym workouts. So exercise even helps people who are institutionalized. And of course, the sad part about it is in the institution, people don't get better food and exercise, they get more drugs. All right? So unfortunately, this doesn't carry over to institutional settings. I already mentioned that there's a big benefit for exercise in terms of recovering from addiction. And many people who are withdrawing from street drugs and opiates suffer from severe depression. So it can be a means to help people avoid relapse to going back to using drugs. The mechanism is exercise assists in the repair of some damage to the brain that results from drug and alcohol abuse. And I already mentioned this brain-derived neurotropic factor. Some people say that this actually results in people becoming smarter over time. It's the reason I'm so smart, is all the exercise. Anyway. ADD. We have an epidemic of kids with ADD, and I think what's really happened is we've taken childhood and we call it a disease now. Being a child is a disease. I mean, I remember when my sister and I were little, we used to run around the neighborhood and ride bikes and all that kinds of, we were sort of at large, you know what I mean? And my mother used to scream and holler to get us to come in for lunch, and then we go out and play and run around, and we did the same thing at my grandparents' house, and now kids are supposed to sit still and be quiet, and that doesn't really work out so well for little children. But anyway, we're drugging a lot of kids, and we probably should just get them to exercise and move around and eat some better food, and maybe some parenting and teacher help as well. But the bottom line is, it doesn't shock you to find out that when energetic kids exercise, they're easier to manage. That's a newsflash, right? Is anybody shocked at that? Like, some of this is just common sense. Take kids who have a lot of energy, let them go outside and run around for an hour, and they will come in and be quieter than if you don't let them do that, right? And of course, the sad part about it is most of the physical education programs around the country are shrinking instead of expanding. And even preschool. My gosh, preschool in the United States and in a lot of westernized countries is more structured learning. I don't think I would have been so good at sitting still and learning something when I was 3 either, right? So kids should exercise. And studies continually support the idea that when kids get an opportunity to move around, you see improvements in social behavior, motor skills, strength, and neuropsychological measures, and there are no adverse side effects, okay? We never hear anybody saying, since my kids started running more, bad things have happened. Has anybody ever heard that from anybody? No. All right. Yoga and mental health. Mental analysis of the studies of effect of yoga on mental health. It had a positive and measurable effect on depression, schizophrenia, ADHD, sleep. Some studies show that yoga has a similar effect on the body to antidepressants and therapy. It increases serotonin levels, lowers inflammation, reduces oxidative stress. And I am not the only person that says this. We joke about it at the yoga studio. Those of us who go to yoga often, it's one of the key reasons we're not in the asylum. Because seriously, because when things are, no matter how screwed up everything is, you go in there for 90 minutes and just focus on your practice and stretching and one thing that I'll tell you what I love about yoga is I love running because I get all my great ideas. The problem with running is I can keep thinking. But have you ever tried to stand on one leg while, for 5 minutes? You can't really make your grocery list and think about what you're going to do at work the next day. When you do, it requires concentration, right? So it does make you mentally check out. So exercise is good for you. So here's the bottom line. It is difficult to withdraw from psychiatric drugs if you've been placed on them. And it can sometimes take a very long period of time. And this is a biological process that can be made better by a lot of things, including good therapy, a good team, taking care of yourself physically, exercise, good eating, that sort of thing. So we have created a course, Dr. Bregan and I created a course called Why and How to Withdraw from Psychiatric Drugs. It's offered through our school. It teaches health professionals how to guide patients through the process of drug withdrawal. Now we have a consumer online course available. So consumers can self-study and then set up their team and talk to their prescribers and the folks that are going to help them do this. So there is help available. There are more resources being made available. And if you're interested in that, you can contact us. We'd be happy to discuss it with you. But just in closing, mental health is not based on chemical imbalances in the brain. It does have a relationship to your physical health. I mean, when you think about it, the average adult puts a ton of food through his body every year. Can you imagine putting a ton of anything through your body and it wouldn't make any difference in how you feel from the tip of your head to your toes, of course, right? That's not hard to understand. Some of this is just common sense. Exercise, humans are meant to move. This most recent sliver of civilization where we all sit all day, it's a tiny sliver. We used to have to move around just to survive. So, I think the average farm worker, I read this someplace, the average farm worker 100 and some years ago used to burn like 9,000 calories a day. And the average farm wife who helped out burned 6,000. We have people right now that burn about 300 calories a day sitting, all right? So we are built to move. And when we move, we feel better. And the human body is incredibly strong. And going back to my Runner's World magazine, the other thing I like reading about is people who decide when they're 85 to run their first marathon. And then they have a good time, so they decide to run a marathon in every state. And then they're 94, and they decide they're going to run a marathon on every continent. And so you really see how strong the human body is and how much it's built for doing healthy things. All right. So there's a relationship between your diet, your microbiome, your exercise patterns or lack thereof, and your mental health. So take advantage of that if you're trying to prevent psychological disorders, and certainly if you're trying to withdraw from drugs or recover from psychological disorders. All right, so we have some time for questions. I hope that was a little perspective. Again, I'm always trying to crunch hours of content into a very short period of time. All right, so who has the mic? Who's got the mic? Or I can repeat the question, one or the other. Okay, so nobody has, oh, here we go. Okay, so we'll start right here. I'll get you.
So my question's about probiotics. They're confusing to buy.
Yeah.
They're supposed to be live organisms. You see them on the shelf at Walmart. You see them cheap, you see them expensive. I've taken them if I have to be on an antibiotic. I take a probiotic. I don't know if I'm doing the right thing by just getting it at Walmart. Yeah. It's just confusing. I would do it more often if I knew that I was buying something worthwhile.
Right, that is a problem, by the way. The first thing is expensive ones are usually better. I hate to tell you that. But there's another issue, and it has to do with buying probiotics off of the store shelves, and that is that the enemy of probiotics is time. They degrade over time. It doesn't really matter if you refrigerate them, it's just time. So you need to buy them from people who turn their inventory often, so they don't sit around very long. We offer them at our office as a courtesy to our people to keep them from having to go through all this mystery hunting and all that sort of thing. So I would find a health professional who's knowledgeable about probiotics, who can tell you the probiotic you should be taking. Because people often take a probiotic that can't help them, or they take it in a dosage that, I've told some people, you're on track to have your gut restored by about the year 2087. So I think you want to speed up the process a little bit. So I would work with somebody who can guide you in that direction. Okay. We'll take one more over here, and then we'll go to the other side. I promise I won't ignore that side of the room.
Hi.
Hi.
We take probiotics and nightly in my family. As I'm not a clinician, but I'm a health coach, and I wonder, is it responsible for me to recommend others take it? Is it safe to recommend, or would that be better recommended by a physician?
They're not unsafe. The biggest problem that people have, or biggest problems people have when they take probiotics, is they buy them from a source that's not the best source, or they're not taking the right one, or they're not taking a high enough dose. So what you might want to do is just get educated to the place where you can recommend the right thing. But you're not going to hurt people by having them take probiotics. I mean, you know, they're not dangerous. Okay. So let's take somebody on this side of the room. How about right here?
Hello, I loved your book, Food Over Medicine.
Thank you.
And can you comment on Crohn's disease and a plant-based diet? And I have a 26-year-old niece that has it. And how do you feel about recreational marijuana?
Yeah, I'll comment on both of those things. I'll start with the Crohn's disease. I did a talk on inflammatory bowel disease last year at this conference, and the conundrum that the Crohn's and colitis patients find themselves in is that what ultimately they need to do is eat a plant-based diet, but when they're in full flare, they sit down and eat what I had for breakfast, and they will be in the hospital by 2 o'clock. You know, so we've developed a diet where we have several phases that start with very simple anti-inflammatory, very limited to just a few foods. And then once people are stable, working with their doctors to get themselves off of drugs, and then beginning food reintroduction. And there's some additional restrictions and that sort of thing. But the reason why it's so important for Crohn's and colitis patients to look outside of traditional medicine is that if you look at the data on drugs that are used to treat the disease, they work for a while, and then they don't work anymore, and you move on to the next drug. Well, if you get Crohn's or colitis when you're 94, then you're probably going to, you could cycle through drugs and live your full lifespan, perhaps in remission. But people are getting this disease at younger ages, like 26. And so if every couple years the drug doesn't work anymore, it's easy to cycle through all of the options, and then you don't have any left, and it's really a shame. But the Crohn's and Colitis Foundation's data show that a third of colitis patients have their colons removed, and that's considered a cure. And it actually is for the colitis, but I don't think anybody wants to do that. But what they don't tell people is you remain just as likely to develop other autoimmune diseases, because colitis is an autoimmune disease. So all this to say, there's hope for your family member, and you can contact our office if you want more information on how all that works. Recreational marijuana, I'm opposed to it. I understand all the arguments for it. People are going to do it anyway. People do a lot of things anyway that we don't permit in our society. I think that we don't know the consequences of this yet. And even as it's being approved for medical use, and one thing I'll say just for the record, I've never understood why we want to limit a terminal cancer patient's access to anything. I mean, I don't get that at all. But I read a book. I got a book last year, and it was the compendium. It was the total compilation of all the studies. It was assembled by the National Institutes of Health, all the studies ever done on cannabis, medical use of cannabis. And there were 4 or 5 things that I found really disturbing in this. And I read the whole thing. I read all of it because I'm an lobbying going on to get marijuana approved for medical purposes and for recreational purposes in all states. And there's no question that the laws need to change, but I think that not a lot of thoughtfulness is going into this, and the right people are not involved in the decision making. And like we have 25% of the country on psychiatric drugs, and some of the other problems you hear about this conference, and then how do we clean up the mess? That's what I think is probably going to happen. So, well, let's go with the mic. So we'll take one more over there, and then we'll come back over here.
Thank you for a wonderful talk. I have a question about fats. Dr. Seyfried, in the diet that he recommended for people with a compromised immune system, he said most of the diet should be fats.
Well, let me talk about that, because there's a lot of confusion about this and the ketogenic diet and all that sort of thing. And of course, the ketogenic diet, people listen to Dr. Seyfried and they're high-fiving it in the back, and the plant-based people are cringing, and they're becoming apoplectic in the back. And so let's try to make some sense out of this so we don't have any apoplectic people. No apoplectic people is our goal here, all right? Okay, so there are some benefits of the ketogenic diet for very specific populations, and I'll tell you who they are. Epileptic children. What Dr. Seyfried talks about, and he's been a speaker at our conferences, so I'm familiar with his work. I read his book, which is very dense, but it's worth reading. So it puts people in a fasting state. Well, you can't fast a toddler for very long at all, so you put the child in ketosis with a very high-fat diet, do it for 2 to 3 years, and most children have a reduction in seizures, and a significant percentage become seizure-free. They can live normal lives. Now, here's the thing you don't hear so much about. They spend the rest of their lives recovering from the time that they spent on the ketogenic diet. There are serious side effects of this diet. So, I've been talking about risk-benefit ratio the whole time I've been here. The risk that you're going to take recovering from the ketogenic diet is better. It justifies the benefit you're going to get, because the alternative is a life of seizures that will cause you to be medicated to the place where you can't go to school, and you can't work, and you can't have a family, and you can't function. So it pays off, right? Another thing, people who have really aggressive certain forms of brain cancer. Brain cancer is very aggressive. Most people don't live. So you can't really, 3 weeks at True North isn't going to fix it, and a plant-based diet isn't going to fix it because it's too aggressive. There's not enough time. So you put people in a state of ketosis, and I remember Dr. Seyfried presenting a case report in Columbus where he talked about a woman he kept in ketosis for 7.5 years. She lived 7.5 years beyond her terminal date. All right, so people say, oh my gosh, you're going to end up with high cholesterol. I'll tell you what, living taking a statin drug is a lot better than being dead with low cholesterol, right? So you always want to be looking at the risk benefits. And so most of the people who are eating a ketogenic diet right now, first of all, they're not doing it. They're just eating a bunch of fat. They don't measure their ketone levels. They're just eating fat and living off the fat of the land, literally. For the people who are trying to do it for health reasons, there are better pathways to reverse your diabetes. There are better pathways to get rid of your arthritis pain. And the risk-benefit ratio does not work out at all for those people, all right? So there's a place for the ketogenic diet. It's just being misconstrued, as so many things are, by people who don't understand science. Okay, does that help? Yes?
What are the good fats? Is it nuts?
Well, fat is fat when it exceeds a certain amount of calories in your diet. And one of the common denominators of healthy populations around the world, they all eat a plant-based diet, they all eat a low-protein diet, and they all eat a low-fat diet. That's the common denominator. Now, the specific foods are different. In Ethiopia, their tiny bit of animal food is goat, and they're eating a lot of tubers. And in Okinawa, it's sweet potatoes, and in rural China, it's rice. They're eating a starch-based carbohydrate diet, low in fat, low in protein. So that's the common denominator. There are no populations living on a high-fat diet on this planet who are thriving. There aren't any. Okay? So fat is fat is fat is fat. It gets a little bit higher. Okay, we're going to go back to this side of the room now. To be fair, who has the mic? Okay, we'll take this gentleman next. We have to be fair. All right, here we go.
I got the mic. Mic's on. Can you hear me?
Yeah.
All right. So when you tell people to go out and walk and they haven't walked in 30 years, think about the dog. The dog never goes for a walk. If they don't go for a walk, the dog never goes for a walk. That dog used to be running around the neighborhood until we had leash laws, okay? So when I started practicing veterinary medicine 50 years ago, everybody was running around the neighborhood. Nobody was spayed or neutered. They had all kinds of energy. Take the dog for a walk. Take yourself for a walk by taking the dog for a walk.
Right.
Not only do you get therapy, but the dog gets therapy.
Yes.
And the poor dog is sitting there. I have, I don't know, maybe 100 clients that tell me, I take the cat for a walk.
Not my cat.
Yeah.
I would have to take my cat for a drag.
For a drag. But not to lose contact with what I'm saying here. Take the dog for a walk. Get him out of this depression of sitting inside and worrying him. They can't let the cat out because the coyotes will get him in most places, except this is where we have a tremendous benefit on Long Island. We don't have coyotes. That's a blessing. But take the dog for a walk, take yourself for a walk, and you'll get your butt out of bed, you get moving. And that's what the whole thing is about.
Right.
It's about getting moving, right?
Exactly.
Right? So we're not going to go into pet food because
Not here.
nobody eats pet food ever unless you're
stopped
crazy.
myself.
Yeah, but what we're going to do is, the thing about what you said is take the dog for a walk,
Exactly.
take yourself for a walk.
Well, you know, I did a workshop on the healing power of pets. And I was hoping, I scheduled this thing, I thought, gosh, I hope I can find some research. But it was astounding how much research I found on how much healthier people are who have pets. And one of the things is people who have dogs are a lot more physically active because they take the dogs for walks, exactly what you were saying. So yeah, having a dog is a very therapeutic thing. Having a cat is a very therapeutic thing. I find my cat is easier to live with than some people. I like him a lot better than my former husband, actually. So. All right, who's next? Microphone is over there. Let's take somebody in the middle there. Okay. So choose somebody. Okay.
Quick question. When you talked about probiotics, are there any benefits to eating fermented foods?
Benefits of fermented foods. Yeah, if you like them, eat them. A lot of people are told that fermented foods are a substitute for probiotics, and they're not. So, and the other thing is there are no magical foods. So if you like sauerkraut, eat it. But if you don't think I'm going to choke it down because it's some kind of magical food that's going to make a difference. And I learned this the hard way. When I started, and I remember having a conversation with a person who said, I said, how's it going? A couple weeks in, she goes, it's all right. I said, well, what's going on? She goes, I'm eating kale. I'm eating green apples. I said, well, it doesn't sound like you like those foods. She goes, I don't. I said, well, why are you eating them? She goes, well, they're good for you. So I learned a long time ago that really the most important thing is to get people eating foods that they like, that they'll stick with. So if you like sauerkraut, eat it. If you don't, it's not a magical food. You could go till the end of your days without ever touching sauerkraut. You would still be a healthy person. Okay. Next person. Pick somebody in. Okay, we'll go here.
Thanks. My niece was on a pretty strict plant-based diet, highly trained athlete. She was a college scholarship volleyball player. And out of nowhere, she changed. She had a break, and she is diagnosed with bipolar disorder. And now I want to know if she has to live on lithium the rest of her life, and two, if your online program would be a benefit to her.
I think our program would be, and I'm going to ask you to ask that question of my colleague, Dr. Peter Bregan, who's much more qualified to answer it than I am. Okay, he can go to the issues with taking lithium. It's a serious issue, and I'm going to let you answer that. Okay. Right. You're welcome. Who's next? Right here. Let's go here. Wait for the mic. There you go.
What are your thoughts about prebiotics?
Prebiotics? Prebiotics can be helpful. The problem is taking them too soon because they're like fertilizer. So if you fertilize the pathogenic bacteria, not so good. So if your lawn is all dandelions, that's not the time to fertilize. You have to get rid of the dandelions and plant some good stuff, and then you fertilize. Okay? So it's the timing of the prebiotics that makes a big difference. All right, let's get somebody over here. Yeah, right here. Come on down.
As a generally healthy person eating a pretty good plant-based diet, are you saying that it's recommended to seek taking probiotics just as a habit, or?
Not necessarily. I mean, there's some people who haven't damaged themselves, you know. I spent the first 20 years of my life doing every bad thing you can imagine. Actually, it started long before my adult life. I used to smoke 4 packs of cigarettes a day because I don't do anything in moderation. I mean, if you're going to smoke, you know, let's smoke, right? So it's not surprising it was like jump to plant-based diet. My first race when I took up running was a marathon. You know, and somebody said, "Did you ever think about like a 5K?" I said, "You got to run. I mean, come on, right? You're going to run." So for somebody like me, who I mean, I did every self-destructive thing you can imagine, and I have to believe that I hurt myself a lot. And so I really eat a very pristine diet, and I do take a probiotic. One thing that is interesting, I've looked for research, is anybody following people who've restored their guts to see how long that lasts. Like, does it last for 7 years and then it goes away, or we don't know. And so I guess I just decided for $1 a day, I thought I'd keep taking them. But I don't necessarily think everybody needs to take a probiotic, but I think a lot of us have hurt ourselves pretty badly, me being one of them. So, okay, somebody on this side there, let's go over here. And then we'll take some people in the back next.
You said just like before we take probiotics, we need to clean prebiotics. We need to clean our guts, right? How do you recommend to do it? And second thing, what time of the day you recommend to take probiotics?
Well, it doesn't matter what time of day you take the probiotic. And the diet, when you adopt a high-fiber plant-based diet with adequate water, you're cleansing every day. There's no additional cleaning needed. Your body's perfectly capable of cleaning house every day. So the key is to eat in a way that preferentially feeds the good bacteria. Your good bacteria like fiber and carbohydrate. Your pathogenic bacteria like animal foods, protein and fat, and processed foods. So what are people eating most of? Processed foods, animal foods, so they're feeding the pathogenic bacteria. So it's not surprising that their guts are in bad shape. So you want to switch that and feed the beneficial folks, okay? So somebody in the back. Do we have somebody in the back who wants, right there?
Thank you. Is there a difference, like a dose effect response of exercise, whether you're low impact, whether you're doing yoga versus you're doing interval training? Is there a difference in the mental health impact that it has?
I think it's all good. I think it's all good for you. I think if you're trying to build a healthy body, I think you need strength training, you need aerobic exercise, and some stretching. I think you need all 3. And the strength training is sometimes the hardest thing to get people to do because they don't like it, because it hurts in the beginning anyway. But it's very important to do that because that's how you have balance and stability and coordination so that you can live your life independently in your house, not end up in some nursing home type situation. Okay? But I think all exercise is good for mental health. And sometimes the place to start with somebody who's really depressed and trying to rebuild their life is just, let's find something you like to do. Whatever it is, let's just start. You start with wherever people are, and then you motivate them. And it's interesting because it's just like the food. Some people start with not as many changes I'd like to see them make, and then they end up jumping off the cliff and eating a diet like mine. And sometimes people will start and they'll say, I'm shocked at how much I like this. You know, I think I'm going to run a 5K. Maybe I'll run a 10K. We have a yoga teacher in Columbus who took up running a few years ago, just for kicks. And she's turned into, like, she trains for something all the time. I mean, it's just amazing because she found out she loved it, So start doing something and then let it take you where it goes. All right. Okay, we can take a couple more. Somebody else in the back. Let's go to another person in the back here.
Hi, thank you for everything. I just recently did a hair sample for an allergy testing or allergy sensitivity. Are they valid? Want to ask that. And protein shakes and juicing in the morning. I usually do protein shakes every morning, but I'm wondering if I should reintroduce more food.
Okay, so the first thing is the hair mineral analysis is not accurate. And you should be very wary of the person who told you to do that. The second thing is protein shakes. I don't know if you heard my talk on Friday, but people think that they're going to run out of protein. They're protein deficient. It is mathematically impossible to structure a calorically adequate diet that's low in protein, too low in protein. In fact, if you were to live on the lowest protein plant foods on the planet, potatoes and rice, you'd be taking in many times your need for protein. And I said this on Friday, but this is a different audience, so I'm going to repeat it again because I think it's important. A lot of the issue about protein and misunderstandings is based on people not understanding the different ways in which your body metabolizes glucose or protein. So in very simple terms, let's get rid of all the biochemistry and just make it simple. Glucose or carbohydrate is to the body like gas is to the car. You put gas in the car, you drive, then you have to go get some more. Right? You eat carbohydrate, converts to glucose, it goes into the cells, fuels your energy. You have to get more when that's used up. Protein is broken down into its constituent amino acids. They go into the amino acid pool. And they get joined together in various combinations to make hormones and enzymes and other things that the body needs. After the enzyme does what it's supposed to do, the amino acid chains are broken apart and they go back into the pool and they're recycled, and they get recycled so many times and then they torch out. All right? So the only thing you need to do is to replace the protein that's actually been used up. So protein is like the fountain in downtown Columbus with 500 gallons of water in it. You don't replace 500 gallons every morning. You replace the 20 gallons that splashed out and evaporated because the water circulates through the fountain. Okay? That's what protein does. So people are always afraid they're going to be protein deficient, and it's almost impossible to do. Your amino acid reserves would keep you going if you ate nothing for a while. All right? So you can ditch the protein shakes and make smoothies out of food. That's what you want to do. All right? All right, we'll take a couple more. Yeah, the protein issue is like, that's the first question people get asked. Where do you get your protein? And I love when Rich Roll talked about, does anybody know who Rich Roll is, the athlete? He said, he was another person, smoked marijuana, took drugs, went through rehab, was an alcoholic, and just all kinds of self-destructive behavior. And he said anytime he wanted to drink or take drugs, his friends would go, okay. Then he told him he was going to convert to and nobody was ever concerned. He said, then I converted to a plant-based diet, and people were like hysterical. Where are you going to get your protein? Like, so all of a sudden, people are very concerned. Not concerned about drugs and alcohol, but a vegan diet, oh my gosh, cause for alarm. So, interesting. Okay, yes, you.
How much protein per day for women?
No way of knowing, all right? And so here's the thing. If you get the dietary pattern right, that'll take care of itself. So here's something that is a newsflash. Back millions of years ago, we did not have any nutrient calculators. We had no labs where you could, send food to be. So how did people survive? They ate food. They ate the available food, which was mostly plant food. So you will never be able to figure this out by trying to count, weigh, and measure. And I'll give you an example. I think I'm an expert. How many people think I'm at least kind of an expert on food and nutrition? Anybody here agree with that? Okay. So I kind of know about this stuff. So I sit down at home and I eat a great big salad and some sweet potato slices I warm up in the microwave. So how are we going to figure out how much of anything is in that? Well, we got to take apart the salad and put all the arugula over here. We got a pile of radishes over here and the black beans over here. This is fun. This really encourage you to love this diet, right? And we got to take the leaf lettuce over here, and we got to take the chickpeas over here, and then we got to weigh it. How many people want to do that every day? Yeah, I'm not doing it. I don't want to do it. Nobody does it. And so people make guesstimations and they feed it into these nutrient calculators, which are inaccurate anyway. Just eat the food. If you just eat the food according to the pattern, then you will get everything that you need. And it's so much more fun that way. Okay. Somebody on this, right there, right behind you. Okay, right behind you. Yeah. We'll take just we have time for a few more.
Thank you. As a thyroid question, what is the best way, because there's so much information out there about thyroid, is a blood test more accurate or a saliva test? And there are so many different saliva tests out there.
Yeah, I prefer blood tests, but the problem we have with thyroid disease is we have this new epidemic now of what's called subclinical hypothyroidism. It's where your TSH level goes up while your other thyroid hormones remain normal. And we're increasingly medicating people at smaller and smaller levels of abnormality. I just wrote a paper on this, by the way. And so the problem is that these people aren't really sick, and then we put them on levothyroxine, and it eventually disables their thyroid, so they are really sick. Great plan, because now they're on levothyroxine for the rest of their lives. And you have this whole thing is being fanned by a few incompetent doctors who have big presences on the website, on the internet, that have these online questionnaires that tell you if you have hypothyroidism, and everybody does, regardless of your blood test. I mean, everybody does. My cat has hypothyroidism based on the test. And I'll tell you how bad the online tests are. Is one night I was training a group of doctors, one guy, 11 women in this class. And we were talking about these online quizzes to tell you if you're sick. So we took one for PMS, and the guy in the group had PMS. That's when we knew these things weren't so good, you know. And we took one for adrenal fatigue, and my cat had adrenal fatigue. He was advised to stop drinking so much coffee and get more rest, which definitely good advice for a cat, right? So anyway, the key is making sure that there's really something wrong with you, and every abnormality is not pathology that needs to be treated. And that's one of the points I was making in the lecture, is that every time you have a negative feeling, you don't need to be drugged. Every time life is hard, you don't need to be drugged. Dr. Bregan says something I repeat all the time: being a human is hard. Okay, it is. It is. It's difficult to live in life. And so sometimes we go through troubles figuring that out. That doesn't mean there's something wrong with you. You don't have a defective brain. You might need to talk to somebody. That's very helpful. But you're not sick. Okay? Yeah. A couple more. Let's go over here.
Could you walk through how someone who uses your service actually gets success, what the steps they go through?
Yeah, it depends on how people use our service, because we offer so many. We own a school, we train health professionals. That's one service people access. But a patient or a client who comes in, sometimes people start, we have varying levels of membership. And sometimes people start with a basic membership, which is just, we try to make it affordable for everybody to get the basic information they need to change their diet and understand how to read and understand medical advice and articles and that sort of thing. For the practitioners who see people and consult with people, we have what's called a concierge service. Concierge is you get one-on-one attention from one of our providers, sometimes me. And in addition to that, you get a whole lot more access to libraries. I have an article library with 2,500 articles in it. We have extensive video libraries. They get access to 300 videos where they can learn online. And then live classes that are conducted every month. Q&A sessions. One of the favorite things that we do is advanced study, where every month I pick a book that I think you all should read, and I know you're not going to do it. And I prepare slide sets and lectures, and we have conversations about it. Then I film the lectures and put them on a video platform. Things you should know. This next week is going to be, or this week on Wednesday, things you should know is going to be about H. pylori, why you don't want to eradicate it with antibiotics. And then there are additional levels that involve taking some of our courses. We have about 1,000 hours of programs online that people can take on cancer and mental health and autism and diabetes and cannabis and gut microbiome, that sort of thing. So, yeah. All right, let's take somebody a little further back over here. Right there, yeah.
Okay, I have two questions. One is, does the insurance pay for this?
I can't hear you, dear.
The insurance, does it pay?
No,
For
insurance doesn't usually pay for things that are worthwhile. Okay, yeah. And I get those emails from my insurance company saying, you haven't had your mammogram, then they try to force me, guilt me into doing it. No, insurance doesn't pay, but you know what? The reason why people are so panicked about paying out of pocket is because they assume it's going to be the way it is with insurance, where you stay chronically ill and you have to have it covered because nobody can afford to pay for medicine to be chronically ill. So the whole key is to get yourself out of the medical mill so that you're not sick all the time and your costs go down. I mean, we can show you that you'll get many times return on your investment if you become a member of our group or somebody who does what we do. Mm-hmm. Okay,
plant-based diet, how much B12 do you need to take?
If you're eating an exclusively B12 plant-based diet, vegan, no fortified foods, you should take a B12 supplement, low dose, a couple times a week.
What's low dose? How much?
Well, like 50 micrograms, because your needs are only 2.4 micrograms a day. So these supplements are huge, like 1,000 times that.
So that's 50 per day?
A couple times a week. All right, so here's the thing, you guys. I have to catch a plane. So here's what we're going to do. I have handouts left, because if I don't catch this plane, people in Columbus are going to be very mad at me tomorrow. Okay, so because we'd have to move like 40 people. So I have to catch a plane, but I will leave my handouts here. My email address is pampopper@msn.com. I always answer my own emails, and you can sign up for my newsletter and my video clips, so you can get free information. We put out free information every week. You can sign up for that. And I'm sorry I have to speak and run, but thank you.